When you listen more,
People listen.
A little more listening.
you understand more.
Fully understand.
More is happening on News Radio 740 KTRH.
It is 7:16 now here in Houston's Morning News. We've been sharing a story with you all morning about healthcare satisfaction or lack thereof.
Right.
Only 7% of us are very satisfied with our healthcare. 28% somewhat satisfied. 31% are not at all satisfied with the current system. Now, here's what I don't know what is meant by that. Are we talking about the quality of the care we're receiving? Are we talking about the cost? You know, are we complaining about our health insurance?
Right.
And how much it doesn't cover? You know, that would be my only complaint right now after my wife made an emergency room visit and I saw what was left over after insurance got done paying for their part. I mean, we're talking thousands of dollars.
Really?
Yeah, I mean, it's not cheap by any stretch of the imagination. Join us to talk about the surveys, Dr. James Pinkney at Diamond Physicians. They run a concierge medical service, and I know that patient satisfaction is always high with concierge medicine, isn't it, Dr. Pinkney?
Jimmy, that's exactly right. The problem with the traditional insurance model is the things that you just mentioned. Cost is tremendous. The value is low. Time with the doctor is about 7 minutes across the country. And ER visits and urgent care visits are tremendously expensive. And what do you really get for $600, $700, $800 a month for insurance? So these are problems that really need to be addressed.
Okay. Well, and the question is, how do we address them? What do we do about that? The cost of medicine is fairly high, and you know, we're paying probably higher prices than most countries around the world. But I don't think the answer is socialized medicine, is it?
No, I don't agree with a single payer system. I think direct primary care, what we do at Diamond Physicians in Dallas, Texas, is taking off. We've got about 1,000 doctors that are converting to this model across the country, and one of our colleagues is actually testifying in front of the Senate in 1 hour. So this is something that you're going to see in the next 6 to 12 months because it really reinvigorates the patient-physician relationship. It takes out insurance, barriers to care, bureaucracy, and takes things back to the 50s and 60s where you could actually have a visit with your doctor for 60 minutes and you pay a monthly capitated rate for unlimited visits and no copays and 24-hour access to your doctor. And it's affordable now.
Okay, how does that compare to what the traditional insurance plan would cost you?
So we're actually at Diamond launching an individual healthcare exchange in January 1 where you can have a insurance product such as an indemnity plan or a short-term limited duration policy or a health shared ministry plan for around $100. And you pair that with direct primary care for another $100 or so. So $200 all in. You have a catastrophic backdrop and a primary care physician that you have access to 24 hours a day. And we include unlimited urgent care. And in some states, the physicians actually dispense medications in their office. So you can have drugs like lisinopril, which is a blood pressure medication for 6 cents a pill instead of $10 a pill.
Wow. Okay. I happen to be on lisinopril. Do you have any appointments available? I'm just kind of wondering, though. I'm listening to $200 a month, and I'm thinking to myself, how do you make money doing that?
Well, when you take out the insurance piece, we spend 60 cents on every dollar trying to file claims and administrative costs. So when you take all that out and you streamline the efficiency of the office, the primary care office, you actually can generate great value. So our doctors actually make more money than insurance doctors. They have more time with their family and more time with their patients, and that equates to better care.
And I'm guessing the more time with the patients. I know I had a concierge physician in Richmond, Virginia, and the thing I loved about it is that even if he was not available right that minute, I'd always hear back from him within an hour or two as far as if I had any question or if I needed to see him. Every time I went there was no big long wait in the waiting room. Usually I was the only one there, maybe one or two other people. You don't sit around wasting your day trying to get in to see the doctor.
That's exactly right. It also is a great product for employers because of the absenteeism that happens when you have to go see a doctor and wait in the office for 2 hours. You end up missing a half a day of work. Or if a parent has to take a child to the doctor, we just launched our pediatrics division, Diamond Pediatrics, 2 weeks ago. So it's really a great service for school districts, for individuals, for all types of employer groups. I think direct primary care is the solution to our healthcare crisis, and we're coming to Houston and the entire state of Texas. So be prepared.
All right. We'll be looking for you. Dr. James Pinkney at Diamond Physicians joining us here on News Radio 740 KTRH.